Today, we're talking about one of the biggest mistakes men make after turning 40. Most men wait until there's symptoms before they take a look at their health. Symptoms like low energy, weight gain, poor recovery, and even erectile dysfunction. But what if there was a blood test that could identify these problems before the symptoms existed? Joining me today is Kenneth Tam, Medical Director at American Medical Wellness. Kenneth, let's jump right in. What is the single most important blood test a man over 40 should take?
That's a really good question. The truth is, there isn't just one blood test. The biggest mistake men make is focusing a single number, like a number of just what your testosterone number is. The blood test every man over 40 should take is actually a comprehensive longevity panel. It tests for things like heart disease, diabetes, hormone decline, cognitive decline. Things like that don't happen overnight. The body starts sending warning signs before symptoms appear. The goal is to find a disease. The goal is simply to identify dysfunction before the disease develops. Most men aren't dying because their testosterone is low. They're getting into trouble because nobody found the problem early enough.
That's a powerful statement and sort of scary. So what are the most important markers you're looking at in these lipid panels?
So I break it into 5 categories. The first is hormones. We look at total testosterone, free testosterone, SHBG, Estradiol, DHEA, pregnenolone, cortisol, and thyroid function. Most men only know their testosterone number. That's like checking your gas gauge but never looking under your hood. You need the full picture.
Makes perfect sense. So when a patient comes in, what symptoms would tell a man his hormones may be declining?
So the obvious symptoms are like low libido, erectile dysfunction, fatigue, and loss of muscle mass. But the symptoms most men ignore are like brain fog, lack of motivation, increased anxiety, poor sleep, slow recovery, especially after workouts. So most men think they're simply just getting older. In reality, their hormones are declining. Most men don't have an age problem, they have a hormone problem.
That makes perfect sense. So I'm sure you see this in category 1. Now category 2, what are you looking at next?
It's always inflammation. This is one of the most overlooked areas in medicine. We look at markers like CRP, homocysteine, ferritin, and fasting insulin. Inflammation is associated with heart disease, Alzheimer's disease, diabetes, and many other cancers. The scary part is most people feel perfectly fine when there's inflammation in their body, but it's still affecting you. So feeling healthy doesn't always mean you're healthy.
That's only halfway terrifying. The silent killer does not seem like something you would want to play around with. So after you've looked at the hormone panels and you've looked at inflammation, what's category 3?
So it's about metabolic health. This is where we look at your fasting glucose, your A1C, your insulin levels, and your lipid profile. Most men know their cholesterol levels. Very few know their insulin level. Insulin resistance is one of the biggest drivers of accelerated aging and chronic disease.
I've heard you say that before, like you were mentioning. Some people look healthy on the outside, but on the inside, they're aging really rapidly.
Absolutely. I've seen fit men with six-pack abs who have terrible metabolic markers. I've also seen overweight patients with surprisingly healthy lab results. Never assume based on appearance. Your blood work tells the truth. Your mirror can lie. Your blood work never does.
Very true. So what's category 4, Ken?
Cardiovascular risk. Most heart attacks happen in people who never knew they were at risk. Beyond standard cholesterol testing, we look at ApoB, lipoproteins, and advanced lipid markers. These tests give a much better picture of the future cardiovascular risk. Heart disease remains #1 killer of men. Many cases can be prevented if we identify the warning signs early.
So in addition to all these things, do you guys test for longevity, and what about biological age? It seems like that's one of the buzzwords that everyone's talking about right now.
That's category 5, advanced longevity testing. Today we can evaluate things like biological age, epigenetic markers, cellular aging, oxidative stress. 2 men can both be 50 years old. One may have the biological age of 40, the other one may have the biological age of 65. Chronological age tells us how long you've lived. Biological age tells us how well you lived. Your birth certificate tells us your age. Your cells tells us the truth.
Well, that's awesome, Ken. So if someone is watching this video and is 45, 50, or even 60 years old, how often should they have this testing done?
At a minimum, I would say 1 time a year. For men actively optimizing their health, every 3 to 6 months is ideal. Think about it. Most people can service their car more often than they evaluate their own health. That's backwards.
What's the biggest mistake you see men make?
Waiting. Men wait until they're exhausted. They wait until they've gained 30 pounds. They wait until they have erectile dysfunction. They wait until they have a heart attack. Prevention is always less expensive and more effective than any treatment. The earlier we identify a problem, the easier it is to address. So, first symptom of heart disease can sometimes be a major cardiac event. That's why waiting is such a dangerous strategy.
Final question, Ken. If you could give every man over 40 one piece of advice, what would it be?
Don't guess, test. You cannot optimize what you don't measure. The smartest investment you can make isn't a stock. It isn't real estate. It's understanding what's happening inside your body before it's too late. The goal isn't simply living longer. The goal is staying healthy long enough to enjoy those extra years.
If you're 40 years old or over and haven't completed a comprehensive blood work recently, now is the time. To learn more about advanced longevity testing, hormone optimization, and preventative health screenings, visit AmericanMedicalWellness.com. If you found this video helpful, subscribe to the channel, leave us a like on the video, and don't forget to comment below with your age and your #1 health goal this year. Thanks again for watching. We'll see you in the next video.